Hi, welcome back to the channel. Good to be here with you. So I've been getting a lot of questions lately about female hair loss. We, as a hair loss specialized practice, obviously I see a lot of females, a lot of women with hair loss. So I thought I would record this video here just to kind of give you a little bit of information on female pattern hair loss and the types of hair loss that can happen for women. It's a very common thing. So let's talk about this a little bit, okay? So women lose hair almost as much as men do. You know, we're just used to seeing more guys with hair loss and different degrees of male pattern baldness. Women struggle with hair loss all the time. I have a lot of family members that have been dealing with hair loss. I see the patients in the office every day coming in looking for solutions and everything for their hair loss. And when you're a woman and you have hair loss, that can be pretty distressing. So a lot of times the history that I get from the patient is this. So I've been noticing my hair falling out in clumps. Every time I go to the shower and I wash my hair, I see a lot of hair in the shower. When I brush my hair, I see a lot of hair coming out on the brush. And what I hear a lot of times too is this, you know, I'm thinking that if I continue to lose this much hair, I won't have anything left in a short time. That doesn't happen. So if you are out there facing this situation, don't worry, but you don't wanna wait forever too. There are multiple things that can cause that hair shedding, but that's a very common complaint that I get here. So just as some basic information, we all shed hair every day. Hair grows in cycles. It has a growth phase, it has a resting phase. So all of us lose about 100 to 150 hair follicles every day. That's just from natural, normal hair cycling. There are always hairs falling out, hairs regrowing. So if you have long hair, if you have curly hair, you're going to see, 100 hairs, 150 hair follicles on a shower. It can look like a lot of hair and it can be stressful. Women usually know how much hair they lose normally. They know what their normal shedding is. So when they come to me saying that they have been shedding a lot more, I believe them because they usually pay attention to those things. When it becomes abnormal is when you see a lot of extra shedding and you're seeing hairs all over your clothes during the day, on your desk. Your scalp is maybe a little itchy, a little irritated, and you're noticing that your ponytail here, the amount of hair you can grab is really drastically reducing. So these are signs that you need to be attentive to and maybe do something about that. The most common cause of hair loss for women is, like for men, genetic and hormonal. It's called female pattern hair loss. I'm not going to cover all the types of hair loss here because the list is huge, but the most common is this. So you have genetics for hair loss from your mom's side or your dad's side, and then as time goes by and your hormones start to act on your hair, you have dihydrotestosterone, DHT, you have thinning. The pattern of thinning in women tends to be different than men. In men we have recession of the hairline, sometimes thinning in the crown, sometimes complete baldness. Women usually don't go completely bald. They have the pattern that we call Christmas tree pattern, which starts with thinning around the central part of the scalp. Start to see that thinning, the part kind of widening. A lot of times they'll lose a little bit here on the interior hairline, almost like a hairline recession. So the pattern of hair loss for females tend to be much more diffuse. And so it's just a different way, but it's still genetic hair loss. To differentiate that from other types of hair loss, we need to do an exam on your scalp or get a very, very good medical history, usually both. So other types of hair loss that can happen in women, the most common one also is telogen effluvium, as just a medical term for excessive shedding. And that's what I see a lot of times here. My main complaint from the patients is my hair has been shedding like crazy lately. Telogen effluvium can be caused by a lot of things. When you go through menopause, that can cause the hormonal changes. If you have a stressful time in your life, maybe someone that's dear to you passed away, or stressful on your job, or you went through a divorce, or you had major surgery. A few months after that, you may notice that your hair has been shedding. So that's a very common complaint I get too. That's telogen effluvium. So it's different than female pattern hair loss. I can differentiate that by your history and by the exam. A lot of times things happen together. A lady may come to me and they've had some slow thinning over the years, the same Christmas tree pattern that we see here, but now they're also facing excessive shedding. So things can happen in combination. So you have to pay attention to that. Other causes that are common in black women, we see a lot of what we call traction hair loss. That's, from pulling the hair tight when you're young, tight hairdos or braids. It can weaken the hairs here on the hairline. So a lot of times I'll see black females coming to the office, they have a band of hair loss here where they lost a lot of their hair. That's due from the traumatic area. There's also diseases that can cause hair loss, and the list is very extensive, but the most common ones are LPP, or lichen planopilaris, which is an autoimmune disease, alopecia areata, which is another autoimmune disease. Then you have centrocentrifugal cicatricial alopecia, or CCCA. That's another autoimmune condition too. And you have frontal fibrosing alopecia. All of those are the most common following telogen effluvium in female pattern hair loss. And again, they can happen in combination. It's not unusual to see a lady that has female pattern hair loss. It's been going on for years. Then she goes through a phase of shedding with telogen effluvium, and then after a while, she starts having these autoimmune diseases in the scalp. So things can combine. Every one of these diseases or hair loss types have specific clinical features and some history data that I know what to look for, and I know what to look for the exam. So we can give you a pretty accurate diagnosis. Sometimes we need a biopsy of your scalp to clarify the diagnosis, but that's the role of the consultation. You come to me either virtually or here in the office, and we will get a history from you and try to figure out what's going on with you. Okay, and then we can offer solutions. There are various types of treatments that we can offer you, from medications to take by mouth, to topical medications, to surgery, to transplants. Depends on what's causing your hair loss. Unfortunately, sometimes hair loss can be deceiving. What looks like one type of hair loss may be another one. And if you're not a specialist on these conditions or hair conditions, sometimes, the doctor may miss it and do, say, a transplant for a condition that's not transplantable. And so, you want to be careful, who you see for your hair loss. Always look for a specialist. Our consultations are free, as you know by now by following the channel. If you didn't know, yes, our consultations are free. So call us and we'll see you virtually or here in the office and give you some recommendation. Okay, no cost and no obligation. So treatments, again, this is an example here. Here's a lady that had pretty much everything. She had female pattern hair loss. You can see the thinning here throughout. She is what we would classify as a class 2, like there's significant thinning, visible thinning here. This is about a year after medications and treatments with her for her hair loss, and we did a small transplant for her. I'm very careful when I recommend transplants for women because you have to have enough hair loss in an area to benefit from that. So it's very tricky sometimes. This is an example of traction hair loss. This lady had hair loss all through this area right here in the front. You can see that there's still the remainders of her hairline, but the hair is becoming very weak. Now, typically with traction alopecia, you see still some hair follicles that are very short, and this is after a session of transplants. I do use medications for these patients to try to maybe get these hairs to grow a little bit thicker, a little bit better, but these patients respond really well to surgery. So what to do if you're facing hair loss of any sort? See someone like me, a specialist in hair loss. Call us, email us, go to our website, the link is below here, and we will set you up for a consultation with me. You will see me. I see every consultation personally, either in the office or virtually, like I said. I'll take a history from you, we'll talk about your hair loss, and I'll offer you some solutions, okay? So that's it for this video. Hope you enjoyed it. If you haven't subscribed to the channel yet, we try to put information here about hair loss of all types, including transplants and non-transplants. So subscribe to the channel. It'll help us out. It'll get this video out to more people. And I'm here to help you whenever I can. Okay? I'll see you later. Take it easy. Bye.